All right. Well, good morning, everyone. I'm Anita Earls. I am here to welcome you on behalf of my co-chair, Secretary Buffalo, who unfortunately cannot be with us this morning. So you all are stuck with me, but I am really excited about our meeting. And thank you all so much for joining us. I know that it is August and it's summer and it's vacation time, but I'm thrilled to be able to share with everyone the incredible work that the task force has been doing throughout the summer. One of my biggest goals for this meeting is that it truly be interactive and that the various committees hear from each other. And because I think there are really valuable and important ways we can support each other through the committee work that needs to happen between now and the end of the year. So I'm very hopeful this will be an interactive meeting. We have a great presentation, which I'll get to in a minute. I want to just give I debated whether to leave this for the Judicial Committee, but I want to kind of start us off with a quick update from the legal world, if you will, the world of courts. And I almost never recommend that anybody read a judicial opinion necessarily, but one of the earliest issues that we heard about as a task force in the very beginning, when we had public hearings and listening sessions across the state, was this question of qualified immunity. And the task force kind of wrestled with, are there recommendations we can make about qualified immunity? And we don't have, in our 125 recommendations, we don't have anything specifically addressing qualified immunity. So I just want to share with you an update that I think is worth your time. If there's one judicial opinion relating to the issues that the task force deals with, that's definitely worth your time, is an opinion issued earlier this year in May by Judge Carlton Reeves in the Southern District of Mississippi. So a federal district court decision. And I'll share this with Brandy. And so you all don't have to look it up. We can circulate it to everyone. The case is Green versus Thomas. And the issue is whether the officer in that case was entitled to qualified immunity. What's remarkable about the decision is Judge Reeves goes through the history of the qualified immunity doctrine, and he does it in a way that's very accessible to non-lawyers. And he also sort of gives an example of the impact of this doctrine across the country, and ultimately concludes that qualified immunity has no basis in law. This is a federal district court opinion with this view. It is an extrajudicial affront to other established or other cherished values of our democracy. He ties qualified immunity to sort of fundamental principles of our democracy. He's just a district court judge. He can't overturn US Supreme Court precedent, but he says that if qualified immunity closes the courthouse doors to this plaintiff's claims, it should come to an overdue end. So for anyone who wanted to respond to the comments that we heard during our initial series of public hearings about qualified immunity, I commend to you Judge Reeves' opinion in Green versus Thomas, and we'll circulate it. So with that little legal interlude, I am really excited to, first of all, introduce to all of you a new member of the task force, although I feel like she's already jumped in and done so much work, it's hardly fair to call her new. But earlier this year, Ricky Hurtado resigned, and huge thanks to the governor for appointing in his place Berenice Malagon. And Berenice, I just, first of all, let me tell you all, she has been working with the local committee and has already made really important contributions to the work of that committee, and just seen a lot of ways in which we are, TREC can, the potential for the work that we're doing to spread even wider and deeper to communities in North Carolina. So Berenice, do you want to take a minute and just introduce yourself to the other task force members?
Justice Earls, unfortunately, I just received an email from Bernice. She had a family emergency and she is not able to join the meeting this morning. She sends her apologies.
I was looking at all my little squares and I didn't see her. Well, that is most unfortunate because she has jumped in with a lot of enthusiasm and really has been doing work. So you all will definitely get a chance to meet her. Our next in-person full task force meeting will be at the end of this year. But in the meantime, I know she'll be continuing to do her work with the local committee. So with that, I'll start off then with our presenter for this meeting. And we are really fortunate to be joined by Kelly Crosby, and I know she's on. So, this is actually going to work. Kelly brings over 30 years of experience in providing and managing public services and supports for people with mental health and substance use issues, intellectual and developmental disabilities, and brain injury. In her current role as the director of NCDHHS Division of Mental Health, Developmental Disabilities, and Substance Use Services, she oversees the public community-based system for mental health, intellectual and other developmental disabilities, substance use, and traumatic brain injury in North Carolina. For the past 13 years, she served in multiple leadership roles within the DHHS, including Assistant Director of Behavioral Health at NC Medicaid, Chief Operating Officer of NC Medicaid, and the Chief Quality and Population Health Officer at NC Medicaid. She's proud to be a licensed clinical social worker and a person with lived experience. These are the issues that she's going to be addressing are things that we've been working on for a while. And so, Kelly, we're really grateful to you for being with us this morning, and I will turn it over to you.
Thank you all so much for having me again. It's nice to see you all again. And sorry for my really long introduction with all the letters, but the letters are actually really important to our division. I know it's a lot to say, but we want to honor our programs for people with mental health issues, substance use issues, intellectual and developmental disabilities, and traumatic brain injury. So it's a lot. We also do problem gambling. We haven't stuffed that in the name yet, but it's just important to honor all those folks. So thank you again for having us here today. And I've been here before, and just to recap for folks, I shared information about the historic investment we got from the General Assembly for different priorities within our public mental health and substance use system. And so today what I'm going to hone in is give you all an update. I'm going to remind you of the funding and the buckets of funding we got, but I'm going to, for this committee, of course, give a very specific update on the funding that we are putting towards behavioral health supports and services for individuals who are involved in the justice system, and also crisis systems, because the systems are so intrinsically aligned. We've made a lot of progress since we spoke, but I also want to give you an update on some new funding opportunities, because year one was very much focused on expanding things that are working. For year two, we want to make sure that we are offering opportunities to communities who don't have a broad array of services right now. We want to make sure that as much as possible with these dollars, we bring access to new services to communities. I'm joined today by different folks from my team, but I want to point out specifically, I know you all know Stella Bailey, but she is definitely our expert here. So if I ever need to phone a friend and get some help, I'll call on Stella. There you are, Stella. Hey, Stella. So, all right, I'm going to share, see how it goes. I tried to only have one PowerPoint open on my desktop. There we go. I think it's working. It's working on my end. 1 second, I need to swap my slideshow. Okay. Can I get a thumbs up? Angela, I can see you. Can you see my slides? Thank you. Thank you kindly. Okay. So here's my update. It's a lot of slides, but I would love to, but please note, even though there's a lot of slides, it's still pretty high level. And if there are specific things that folks would like additional information on, welcome any feedback, always feedback, welcome feedback, because you all are experts. This is public money, and it's our job to use it to the best of our ability. And that means getting feedback from experts such as yourself. So appreciate the feedback and appreciate any questions that you have, and we will do our best to answer them. Okay, try to make it go forward. Here we go. So this is just what I'm going to cover. I'm going to just do a recap of our investments, and then specifically our plans for programs for individuals who are justice involved, individual or services in our crisis system that we're trying to stand up and enhance. And then, as I mentioned, I do want to talk about upcoming funding opportunities and webinars we'll be having. Okay. So just as a reminder, our agency with all the letters, we are the part of DHHS that is responsible for the public mental health, substance use, IDD, and traumatic brain injury system. It's just important for us that we lead with our principles, our values, and our vision. We are working on updating our 5-year strategic plan. It is almost about to be published, and I show it to you today because 2 of the priorities for us as a division within the department are part of what I want to talk with you about today. And that's specifically strengthening the crisis system, but also expanding services for individuals in the justice system. So those have made it to the top of our core priorities of our agency. And so everything we're doing is not just about the funding we've gotten from the General Assembly, this new one-time funding. It is about our ongoing operations and thinking through how we're spending our ongoing funding and working collaboratively within the system, the ongoing system. So how we work with Medicaid, how we work with LME MCOs, how we work with counties, right? Lots of people get lots of funding. This is a priority for us to connect with those other agencies and make sure that our strategic priorities are addressing individuals involved in the justice system. So just wanted to show you that this is very core to us and is part of our 5-year strategic plan. As a reminder, we did get a one-time historic investment in the behavioral health system during last year's long session. This is how all the money breaks down. About half of it goes to increasing behavioral health rates in the Medicaid program, so mental health and substance use services. But the buckets I'm going to talk today are about the crisis system, got about $131 million for the crisis system and another 99 for individuals involved in the justice system. So that's very exciting. Our approach has always been, and it's important that we reiterate this, want you to hear it, and I think it's part of your guiding principles as a committee as well. First and foremost, we want to engage the community and our partners such as yourself. We're trying to be really smart and not just sort of randomly giving money out, right? Because you don't get money very often. We're trying to be really smart and use data to help us identify where investments might have the broadest reach, matter the most, and where places are really underserved. So again, let us target those areas that are underserved. And we are building in measures of success from the beginning, because again, we should be able to say our goal for this money is this. We chose to use the money this way because this data tells us to. And here's our commitment to the public. Every half year, we're going to show you how we're doing, the impact of the dollars on our community. So this is kind of the framework by which we are approaching and have approached these investments. To that community collaboration approach, I always have to put a plug in for our the way we engage the community very systematically every month. And this is just our normal course of events. Every month we have our side-by-side webinar. Our second row there, our second level meetings or groups that we engage with routinely. But on the bottom in that gray, I want to call your attention to the gray box at the bottom. These are investment advisory committees. And if anyone is interested in my PowerPoint, there'll be a QR code. We have, as you can see, we have a very specific crisis advisory committee, but also a justice advisory committee. Stella leads that committee. So you are welcome. These are public meetings. Many of you are already involved in those. We're glad that you are. We welcome them. And that's the place where we talk very specifically about these funding buckets. So you're welcome to come. Please come. Okay, so let's talk about our plans, actually. This is actually a snapshot from our strategic plan, not surprisingly, right? I don't think you're going to be like totally blown away by what our goals are in the space of supporting individuals in the justice system.
With Amanda.
And so we are trying to increase deflection and diversion programs. We are trying to support successful community reentry. Again, these aren't surprises.
All right.
We're trying to make sure that we have more and predictable and effective community-based programs for kids, for juveniles, folks involved in the juvenile justice system. And of course, we want to expand access to capacity restoration. So no big surprise. So you will see this is our priority. And when I say priority, it's for these new budget investments, but it's also for ongoing federal dollars that we get, federal opportunities, and state allocations that we get from the General Assembly as well. So there's lots of different funding buckets that we use here, and our collaboration with state Medicaid agency, of course, right? Okay. So here's kind of how we're thinking about the core behavioral health services for individuals involved in the justice system. Are some of our very big priorities with the dollars. And I'm not going to talk about all of them today, but we can unpack any of the ones folks are interested in. First is education. One of the things we're very aware of, very mindful of, that in general, despite very good efforts over the years, the system of services and supports, very specifically mental health services and supports in our communities is baffling and confusing to most people, right? And this is across the board. All walks of life, all socioeconomic, all communities, it's by and large confusing, right? So one of the things that we want to do is to educate folks about the system of services and supports that we do have. And I will unpack that services and supports for a moment. We would also like, as much as possible, predictability. Part of the confusion isn't just in not quite understanding the services and support system, which can be really confusing. It's also how much it varies. And some of that variation is good, right? Communities need to have their own services that make sense for themselves. But as a public system, we are trying to commit to some uniformity and predictability in communities. So officers of the court know what to expect. So sheriffs, so law enforcement, so probation and parole, so YDCs. So average families can understand what they should by and large expect in a community, what should be available to them in terms of mental health and substance use services. So to that end, we are trying to focus on some really core services when we think about both diversion and reentry. We're thinking about things like care management in all its forms and fashions. There's many forms and fashions, but also just services. So even in places where we have things like the LEAD program, we have TASK, we have other forms of care management. What we hear a lot from those care managers is we don't always have services and supports to refer people to. And in this county, they're called this, and in that county, they're called that. So we are trying to make sure that as we develop good transition services, i.e. care management on the front and on the back end for diversion and reentry, they're predictable, they're well-known, they're well-trusted, they're effective, and that those care managers have good services to refer people to that, again, are somewhat predictable. Those could be substance use services, mental health services, whatever, right? So let's get the system fairly predictable and then educate folks about it and how to get connected to it, okay? And then, of course, the other big focus for us are just those other supports that are absolutely necessary for folks. Housing comes to the top first and foremost. Transitional housing, transitional housing, transitional housing. So these are kind of the buckets, I would say, that we are distilling investments down into. So now I'll tell you about a couple of very specific ones where we have already released additional funding. And there'll be more opportunities, so please stay tuned for more opportunities. So we have a program with all of our LME MCOs. I think you know what they are. They are our public local partners for mental health, substance use, IDD, and TBI, right? We send federal dollars through them to agencies. We send state dollars to them through agencies. We fund them. We fund our LMEs, our local management entities. We fund them. So they're VIA, Alliance, Trillium, and partners, right? Hopefully you know them in your counties. We actually fund them. They have a partnership with DAC. It is for priority populations, high priority populations, to get care management and stabilization to be able to come out of prison back into the community. That's been pretty successful. It's not easy. These are some individuals with the most complex needs. often take high amounts of wraparound services and supports for a very long time to get stable in the community. And I'm talking like often very, it could be fairly serious mental health issues, for example. So we are continuing to refund and increase funding for that program. So we want all of the LMEs to have more care coordinators, more peer specialists, and we're also enhancing that funding with housing support dollars. So it's been very effective. They've been really able to connect people on their priority list from DAC to community programs. Because it has been effective, we are trying to increase the funding there. We are also looking at giving additional funding to that program so they can focus also on individuals with intellectual and developmental disabilities coming out of prison. You've probably also heard about, and there's probably folks on here who are very familiar with the NC Fit program out of UNC. Again, wonderful rates of getting folks connected to both medical care, mental health, substance use care, stable housing, real huge reductions in things like emergency health care, certainly reductions in recidivism, good connections and engagement with services, which is great for the person, which is what we really want to see. So we are expanding that program. We had a big public announcement. But this is an example, just to put a fine point on it, this is an example of care management services that connect people to care. The LME knows the care delivery system, so that works for them. And then UNC Fit not only provides the care management, they provide a lot of the services too. So they're kind of these neat packages where you can get services and also care management. So that model is what we're trying to make sure that we have. Through LMEs, we already have in all counties this priority care management. It's only for small amounts of people, so we need more of it. And obviously, Wake, Orange, and Durham, and New Hanover aren't the only counties in the state that need reentry programs. There are a lot more, by the way. I think there's 25, but I'm just saying, like, these are examples of things we want to fund more of. And you can see some of the outcomes at the bottom. So these are exactly the kind of outcomes that we're looking for. Okay. We are also, and there's a highlight on this slide that I want to highlight again. I'm not going to go into everything, but we are also, when I tell about the funding opportunity at the end, we do fund not many, but some deflection and diversion programs now in the state. There are other diversion and deflection programs that are funded through other funding sources. We acknowledge that. But one of the things we want to do with our funding is, besides those reentry programs that I mentioned and expanding those, we want to expand more deflection and diversion programs. For example, like the LEAD program. I know that you're all very familiar with the LEAD program. I like the LEAD program. And one of the things we're trying to sort through, to be perfectly transparent with you, is how much variation do we want to support? We support things that make sense for local communities, but from a perspective of our ability to find diversified funding, such as through Medicaid, or to provide technical assistance to programs, having a limited number of programs that we support is actually kind of important for us. So right now we're really thinking through, are there very specific models of deflection and diversion and reentry care management type programs? And those are the models we want to just fund consistently. Again, so there's consistent knowledge and we can provide technical support and training. And again, consistent funding. Anytime we can say, here's a consistent program, Medicaid, would you please fund it through Medicaid? It's a win for us. Okay, so more deflection and diversion programs. I mentioned treatment a lot because, again, people have a hard time finding treatment, and we do not have a consistent treatment. We don't have consistent treatment programs across the state. We just don't, and that's a problem. It's a problem for our division, and it's one we want to help solve. The other thing specific to individuals involved in the justice system is, even if you have treatment in your community, right? You've got therapy, you've got a psychiatrist, you've got things like an ACT team, which is our highest level of wraparound community care. It doesn't mean in any way that those professionals are equipped to understand the unique needs of individuals who have been involved in the justice system. That's just a reality. It just is. It doesn't always mean we need a special mental health program. It does mean that we need to make sure that our programs are trained and understand the unique experiences, whether it's trauma, whether it's managing the complexities of parole, probation, whatever it is, finding a job again, connecting to your family again. It's unique, right? You know that. Again, I'm talking to a bunch of experts. I'm a clinician. And I know my limitations. I had the privilege of working in the juvenile justice system. When I first worked in the juvenile justice, I didn't know what was going on. I had to learn all new terms. I had to learn all new experiences that families had to walk through. And so we just can't assume, even if you have clinical services in any particular region, that they can understand and adequately address the needs of folks in the justice system. So one of the specific models that we are working with every LME on, so we have in each region, is something called a FACT team. So again, ACT is a very high level of community care. It is a team-based approach where they've got a nurse who can help with meds, a consulting psychiatrist. They've got clinicians, they've got peers, which I love. They've got job coaches. They are in the community. But there are specific models that give specific training and support for individuals who've been involved in the justice system. So these are popping up around the country. There are not many of them, but we're getting consulting from a team who is doing these so we can stand these up in each region. So again, it's a very high level of team-based mental health care, could be substance use as well. We want them in all communities. And these, again, these are folks who are getting special training and can respond to the unique needs and have a better understanding of individuals who've been involved in the justice system. I mentioned technical assistance across the bottom. We're a bit big on technical assistance. And as a clinician, I say this from experience. There is no way that school will ever prepare you for all the things you might come across. It's very important to keep learning. And it's very important for us as a state, if there are specific models that we support, that we're making sure that we're supporting those clinicians and those agencies to do them right and well and always improve. So making sure that we're providing technical assistance and quality improvement is a priority for us across these justice investments, which also points to why it's actually important for not just communities to have predictability in services, but us. We can only support so many models of care. So let's pick the best ones and support the heck out of them. Okay. So I mentioned capacity restoration already. I think you all are well versed in capacity restoration. We continue to be incredibly pleased with the results that we're seeing in Mecklenburg County. And there's a wonderful team led by, Bob, Dr. Carrie Brown through DSOF, who is working to expand those programs across the state. So we have 3 programs across the state that are regional models that are centered around the adult psychiatric hospitals. And that we're getting folks in capacity restoration quickly, effectively, and getting them restored to the community as fast as possible. Okay. The last thing I'll say is sort of that model that I talked about for adults, which is, again, how do we have predictable care management and services in communities, whether it's coming or going, deflection, diversion, and reentry. How do we educate the community on those services? And everybody, right? Parole, probation, court officers, behavioral health professionals, LMEs, counties, DSS. How does everybody know what those programs are? So how do we do effective education? And then how do we fund additional supports that make that a reality? Think of the same model in the juvenile justice system, right? We want the same thing, a predictable system, an easy to understand and enter system, and then support and education to the community so they know how to access and use the system, right? So trying to build the same thing for juvenile justice. And I want to highlight 3 priority projects. The one in the middle is the extra special big one. But we have some wonderful partnerships with our colleagues at DJJ. One is the Credible Messengers program, which we're really excited about. And so these will be credible messengers that are working with the YDCs. We would like to see how this works. And if it works well, we would love, in partnership, of course, with DJJ, to make this available in communities where it makes sense. We also have expansion of NC Safe. So we have money, and we also have safes for safe storage of firearms. So we're working with DJJ on the best way to get those into the hands of families where they're needed. The middle is the thing that I'm excited about both of those, but I'm really excited about, you probably know, but a lot of people don't know that we have juvenile justice behavioral health teams. So again, we fund those teams in every community. Now, it doesn't mean every community has one. It does mean each region has one, right? And the concept is the same, right? These are individuals we fund through the LMEs, and it is their job to make sure there's adequate programming, there's adequate care management, there are partnerships among all the people that need to understand the service delivery system, the juvenile justice system in their communities. Some of them are working well, some of them perhaps could use some improvement, right? So Stella's team has been working to refund those partnerships significantly, but also offer them technical assistance coaching, but also expectations for how we expect those partnerships to work. And that's not us saying we have all the answers, not at all. It is us listening. It's a partnership with those collaboratives to say what is working well in communities. Good, let's all adopt that kind of model, right? For example. But again, we are grateful to have just a huge infusion of funding through the General Assembly allocation to be able to heavily fund these juvenile justice partnerships to do those things that I said. Make sure we have adequate services, educate the community, put together the right partnerships, and have good models of care management that make sense. Okay, talk about crisis system right quick, keeping an eye on my clock. So again, we got lots of crisis system funding, but it's just one of our priorities for us. This is the crisis system that we have loosely and that we're trying to build. We are calling it crisis to care because we need to move away from crisis in our system. But in order to do that, we need to have an effective crisis system that works, right? We already have someone to contact. More and more every single day, folks are learning about 988 and then it's our primary place of contact. We have other places of contact, but the primary one that we advertise and we want folks to connect to is 988. We're working every day to make sure 988 does the best job they can do, that they get additional training and supports, that people feel comfortable and safe calling them, and they're equipped with good community referral sources for folks. Things like next day appointments, that they can connect directly to mobile crisis teams, that they know where there are facility-based crisis beds if anyone ever needs to go to them, right? So there's a lot that we're working on with them to make sure they have the right community connections for when people call. You will see, you don't see a lot of it now, but you will see a lot of work in the mobile crisis space. So mobile crisis teams. It is our preference that it is better to have, when someone has a mental health crisis, that a mobile crisis team responds. Those are trained mental health professionals, unmarked car. Hopefully the role is for them to de-escalate the situation, period, and help get the family connected to care. If possible, we'd like mobile crisis teams. If someone does need to go to a hospital or crisis facility, that the mobile crisis team can transport them to the nearest behavioral health, urgent care, or facility-based crisis, or if the person does need to be hospitalized, to the hospital. We know that's not happening everywhere, and we know more often than not that 911 is dispatched because that is familiar to the community. It is quick, it is efficient, and we don't have that level of quickness, efficiency, trust, responsiveness in our mobile crisis system right now. But we will continue to fund and improve mobile crisis team response. MORS, which is a special program for juveniles that not only does crisis de-escalation, they maintain with the family for 3 to 6 months afterwards to make sure that they're really addressing the root causes of the crisis and getting the family connected to care. And we just funded 4 new co-responder teams in the West, and we will continue to fund more of those because the reality is that many people will still call 911, and that's okay. We want to make sure that our mobile crisis teams, our EMTs, are equipped with mental health professionals that can help in those situations. So that's sort of the space we're working on very hard right now, right? I'm going to show you in a minute. I think I have a slide that talks about the investments we've already made in a safe place to go. Someone to contact, someone to respond, in a safe place to go. For us, that is a behavioral health small community facility. It is not an emergency room, just isn't. Now, there are always people who are harm to self, harm to others, right? Need to be hospitalized, right? In most cases, though, individuals can go to an urgent care, just like they would go to a medical urgent care, our behavioral health urgent cares. Things that we call facility-based crisis, but we've taken to calling them community crisis centers. We also have a growing number of peer respites where individuals with mental health issues or substance use feel more comfortable going. They are home-like settings. They look like little houses, they're apartments. And again, it has a less medical feel and it is much more comfortable for lots of folks. And then we do have specialized models, not many. I think we have 12 beds across the state for individuals with intellectual and developmental disabilities. So that's something we're trying to make sure that we know the right model to expand. So I will show you in a minute, like where these investments are. And again, this was a place we really used data to help us inform where to put these facilities. So these are some of the things we've already done in this space with the funding. We launched the Peer Warm Line. Peer Warm Line's been active for 5 months. So we have 988, which everybody can call. We advertise the heck out of. 988 can transfer calls to Peer Warm Line if someone just needs a peer to talk to. People can call the Peer Line directly. It's 1-855 Peers NC. We try to make it easy. Guess how many people are calling the Peer Warm Line every month? 8,000 after 5 months. Stunning. 8,000 are calling 988. 8,000 are calling the Peer Warm Line. People need help. They're calling. They trust these lines. Thank goodness. That's why we're super focused then on making sure this, once people call 988 or Peer Warm Line, can get them where they need to go quickly, whether it's crisis, whether it's a next day service, whatever it is. We've invested 1.5 million in co-responder models, more to come. 1 peer respite and some co-responder models, more to come. 15 million in 9 new behavioral health urgent cares. I think I have a map I'll show you. That was data informed. Every county wants an urgent care. I want every county to have an urgent care. They're really expensive, y'all. They're used by everybody. And the only sources of funding, though, are Medicaid for about 40% of the population, if you're lucky. The other 60% is purely out of public funds. Even though folks with insurance go, they just don't pay for it. So these are really expensive and hard to maintain, but worthwhile. We invested another 22 million in community crisis centers. I think that got us 64 adult beds and 44 child beds. Again, data informed by where we put them. And that's just a picture of one of the awesome ribbon cuttings. We do a ribbon cutting about every month. They are such a celebration. That one is in Alamance. We did one in Rockingham, and this one in Alamance blew me away. Some of the first speakers were law officers. A retired one spoke about his first call as a young officer. It was unfortunately for a man who completed suicide in front of him. That was his first call. And it became his mission to build this center. And it is a beautiful thing. The county's there, law enforcement is there. We were able to support it with funding as well. This is an urgent care. There's partnership with law enforcement there's a drop-off center. This center is good about like, from start to finish, it takes 20 minutes to get someone in and out. I mean, it's right on the way to the hospital. I mean, this is what we're trying to build, right? Places that law enforcement can go to, that admit people that law enforcement can trust, but also that families can go to, that families can trust. This is both an urgent care, a community crisis center, and there's a peer living room there. So it's a really cool center. So really cool. We're trying to build more of these. But again, you don't need them everywhere. You need them in reasonable places, and again, expensive to maintain, but absolutely worth it. Here's where they are. So all the yellow highlighted things are all new. We've increased our capacity exponentially. The darker the county on this map, the more people waiting in emergency rooms. So we divided the state up into patterns of care. We looked at the counties that had the highest incidence of people languishing in emergency rooms. Those are adults or kids. And this is where the urgent cares and facility-based crisis are it could be just upfitted, buildings being upfitted, wings being added. We're also trying to be smart. We're not breaking a lot of new ground. We're just expanding space in buildings and places. And now we're working on our crisis to care campaign, which is interactive maps, places where we can advertise so people know where there's an urgent care, they can know where there's a community crisis clinic. So yeah, we're working on that now. Okay, I mentioned mobile crisis. That's kind of what we're really focused on now. We're working on all the facilities. 988 is really running well. Peer Line is really running well. That's not saying it doesn't need improvements, but that mobile crisis is just not ideal. We have something called Mobile Crisis Moors in North Carolina. It's only in 7 counties. But again, this is a really good family and adolescent tool. They can stabilize and stay with the community. We're seeing good things happen in states who have been using them for a while. Less and less kids are actually going to emergency rooms, which is exciting. Families are able to stay together. That means less DSS involvement. It often can mean less juvenile justice involvement as well. So we're just starting these. And we're thinking through where do we need more of them. I'm not sure why I have another facility-based crisis for kids map, but here's another facility-based crisis for kids map. This one's really exciting for us. I know that Charles spoke to a subcommittee about it. I may have mentioned it before, but I would say we're about 2 to 3 months out of putting out our RFP for our non-law enforcement alternative transportation pilot. And here's where it's going to start. Where it's going to start is for those adults and kids who are in emergency rooms. They've been waiting. A bed is finally found for that person, and they need to be transported to that facility. I'm just telling you what the goal of this program is right now. So what we don't want is the hospital having to rely on calling law enforcement to put the individual in a police car to take them to the next, to the mental health facility where they'll be admitted. That's not what we want. So this non-law enforcement transportation will literally just be transportation from the hospital to the hospital that will be admitting the person, right? So we'll be putting out that RFP. We've done so much work meeting with counties, meeting with hospitals. Some hospitals do this already with their own system, which is really cool. So we're trying to learn a lot from them. So we're doing that pilot. I hope you heard me say earlier on mobile crisis, we're also trying to strengthen mobile crisis. So when a person gets a crisis response in their home, we don't need law enforcement to transport there either. The mobile crisis team can actually transport either in their vehicle or a van to hopefully facility-based crisis center, not even the hospital, right? But this pilot is very specific. We do need to do a pilot. There's a lot of moving parts here in North Carolina. We have to try it out before we do anything big and statewide. Okay, so we're very excited about this. Right now, the RFP is just going through the myriad number of permissions it's got to go through before we can publish it. We are also working on this. This is a lot of words. You may or may not know we have a bed board in North Carolina. It's called BH Scan. On any given day, we can see where we have open beds in crisis facilities, but also hospitals, community hospitals for kids and adults. Why does this matter? Part of what we're doing is making sure that our 988 system is connected to the bed registry, we call BH Scan, but we're also adding functionality where we can deploy and track mobile crisis teams. What's this? I think you all know what this has to do with justice, but just to put a fine point on it, again, we want people to call 988, not 911. When they call 988, we want to be able to deploy a mobile crisis team. We don't even want families to have to know what the 1-800 number. We just call 988. 988 will find the nearest and deploy the mobile crisis team and track. We want them there in 30 minutes or less. We want mobile crisis to be able to transport people. So we're trying to break that chain of involving law enforcement or EMTs in a mental health crisis incident. It is not a necessary time for law enforcement. And so many communities that I go to, so many people, parents especially, parents of people with intellectual and developmental disabilities and autism, adults who have been in the mental health system themselves or have loved ones. You know, they're just so fearful. They are so fearful of calling 911. They're just fearful. They've not had good experiences. Our system has not treated them well. I promise you that is not a dig on law enforcement. It is not. But it is hard. It is scary. Scary to go in an ambulance. Scary to go to an emergency room. And we've not done a good job historically of really supporting people in those environments here in mental health crisis. So we are trying to make sure that we have mental health professionals trained, ready, professionally ready there for people in mental health crisis. So we don't have incidents. So we don't have people involved in law enforcement. So we don't ask law officers to do things that is not their job, right? So part of this is just having, and we got money for it, which is nice, the smart technology where 988 can be much closer to a 911 deployment center, right? We don't have that right now in mental health, and we really need it. Okay. Upcoming funding opportunities. I mentioned the non-law enforcement transportation pilot. At the end of August, we will be having a webinar on our RFA for more community justice programs. We'll be looking for kind of categorically like 3 kind of things, right? Care management programs and the expansion of those care management, because those are the things that help connect people to services, right? So that for housing and transitional housing, right? And other services that people might need. Just those things, right? I'm just trying to we don't need to use all the fancy names, but people need to be connected. They need transitional supports like housing, and they need services, period. Right? So we'll be putting out more money in communities who do not have those programs, or potentially for programs that are doing really well to expand. Okay. All right, there's just some things in the appendix. I think I shared these slides with folks. Those are just the continuums of care, but this is interesting. This talks about a lot of the programs that we already fund if you're interested. And again, we looked at all of this to see where we should expand and also places where we have those. Because like when you look at reentry, great, we have 43 reentry programs. What about the other, how many is that? 57 counties, right? So that's what I'm saying. Like we're looking at data about where we should invest and where we don't have investments right now. Okay. And this we're particularly fond of, but I know I'm in the appendix, but I want to show you something that just some wonderful outcomes. And I don't have the other outcome slide, but one of the things that we know and that you as a committee know is that individuals of color are disproportionately involved in the justice system here in North Carolina, right? But as a nation, right? So one of the things that we put out as a charge is in some of our diversion programs, we wanted to make sure that we were setting targets to divert more people of color into treatment programs, right? We want to help whatever we can do to stop that trend of people of color being disproportionately involved in justice. So I don't have that slide, but we should share it because I'm really proud of the team for focusing on that and achieving it. Our programs are getting more individuals of color diverted into treatment. And that's what we need to see on the diversion and the reentry side. So we have the ability through our funding and through our programs to target specific communities that are marginalized, populations that are marginalized, and make sure that we're getting them into treatment. So that's cool. All right, so I wasn't going to show you the appendix, but I couldn't help myself. Okay. With that, I will stop and I lost track of time, so I hope I didn't go too far over, but happy to take we love feedback, like do this better, do that. We'd like to hear about this more. I didn't do all the things that we're doing or planning to spend on. I was trying to hit the highlights. So welcome feedback and questions. If there is time, I defer to the chairs about time.
Yes, certainly. We definitely have time for questions. So if anyone has questions or comments or feedback, just go ahead and unmute. Okay, I don't see, Chief Jennings, go right ahead.
Yeah, thank you very much. Very interesting and appreciate the presentation. Really what got my attention was for the juveniles. And I think that, I don't know if it's necessarily a question, but I'd love to see the resources in that, because when you really talk about juveniles and you break a cycle, a generational cycle, you're saving more than just that kid. You're probably saving more, their kids and their grandkids. So very interested in that, and glad to hear that we're putting some focus there.
Thank you, Chief Jennings. That's the toughest job I ever had. I worked in Philadelphia, and it would be my job to try to find, these were kids who were in the YDC, and I would work with treatment providers to get them to assess the child as fast as possible and take the child into their treatment center. And then I'd have to go advocate to the court that that was the right decision. It was just a really, really hard job. And that was probably 20 years ago. And it was rough. So I'd like to think we have more resources, better decision-making now. But I think there's a lot of room for improvement.
Representative Maury.
Morning, Kelly, thank you. I think that was a fascinating, great presentation, identifying all the needs. It's such a huge spectrum. What I'm wondering and what I see is, we identify the needs and the problem points and these great programs, but we still don't have enough qualified professionals to come in and staff it.
That is so true. Part of our, just to give folks the brief version, part of our strategic plan also is on workforce initiatives. And so to this committee in particular, there are, I'd say, 3 things that we are working on. And again, in collaboration, right? Because I think that's how it's done best. The first is you don't need my speech, but I could give you a big one on why I believe in peers, the power of peers. We have so many certified and trained peers, including folks with lots of forensic experience. We're not good at lifting those services up and getting those folks employed and supported in employment. So we've been focused for the last 6 months on getting folks certified, including folks being certified as forensic peers, and also trying to figure out how to fund their programs and or get them employed at providers. Because we actually, I don't know if you believe this, we have 4,000 certified peers in North Carolina. So few of them are actually employed. It is a very untapped resource that I think is incredibly effective. So with some of our other funding sources, we're standing up more peer programs that will employ these certified peers. And we're trying to work with providers so they will hire peers. Because again, in crisis systems, when we have these forensics teams going out, we think peers are just really part of the formula. I don't know about you, and I know it was a simulation, right? But the re-entry simulation, like everybody that I talked to in my experience was the most helpful, kind of the only helpful person in the whole room were the folks playing the peer support role. They were freaking awesome. They'd give you tips, they'd give you a bus pass. I went to prison every night, I need you to know. But the only glimmer of hope or help I had was actually from the peers. And I don't think that was just a fantasy. I think that was how it works. So peers, but also in addition, 2 other things. We have in North Carolina, we have our own rule about who can provide mental health services. It's very antiquated and old. And we're actually working with the whole North Carolina community college system. They have this associate's degree that is like a mental health technician associate's degree. They're pumping out associates. We have 0 match between who we hire and this fact that there's this gorgeous mental health tech. It's not called mental health tech, though, it's called mental health technician. So we've been talking with the community health or the community college system about how we can change our rules to say, hey, those folks with that degree, you are actually prepared. We can hire you, agencies can hire you, we will pay you in Medicaid to provide these services. So we think there's folks with a degree that aren't getting employed like they should be. But also we're spending some time working with the professional associations in North Carolina, and our first university that we're working with is UNC. We actually we are rich in graduates. We are. None of them want to work in the public system though. So we're hearing the honest, brutal feedback about why. Most of them don't get it because our system's too confusing. And then we pay lousy. We require lots of paperwork. So all the things. So we are trying to focus on the barriers in our system where we have untapped workforce and just to try to get more folks trained. But I think, as I said before, like even if you're trained in mental health, it doesn't mean that you understand how to help people involved in the justice system. It adds a level of, like, I know our system's complex. The justice system is also complex. So part of what we're doing is how can we better train and support those in the mental health workforce so they actually do a good job with justice involved populations. But I thank you for that feedback. I think this workforce thing will take a very, very long time to solve. But we're focused on both quantity and quality. We haven't been focused on quality and workforce for a long time because unfortunately, sometimes we give people services and they're terrifically ineffective. So like we just wasted a lot of time and money in their life. So we need quality and quantity.
Representative Moore, I know you got cut off there. Did you get to finish? Was there more to your question or did that respond? Was that responsive?
That's great. I'm sorry, my Apple died. So I'm back on my phone, but thank you very much. I appreciate it.
I think next in line is Kerwin Pittman.
Thank you, Kelly, for that great presentation. I had never heard of a behavioral health urgent care before, and so learning of this is extremely important. So was just curious about the makeup of the crisis call diversion team. Like what specialists are on this team?
Yeah. So right now, our mental health, our mobile crisis teams, right? they are, and I'll use language that our field uses, and then I'll try to explain it. There has to be a licensed clinician and a psychiatrist available for consultation, triage, sometimes to actually go do the response. But a lot of times it's something that we call a qualified professional. And that's just someone with a human service degree. It could be master's, could be bachelor's, but also have training in crisis response. So again, that's been one of our workforce issues because we can't get enough licensed people willing to go and respond in homes. So that's typically who it is. Sometimes it's a peer, so they'll go with a peer as well, which is really cool. And again, we think peers are really effective, but that's kind of the makeup of a team. You've got a licensed professional, multiple of those qualified professionals, usually a peer on the team, and there's always a consulting psychiatrist who's got to approve the visit, sign off on it, and then also consult like the level of safety of the person. Would they say they need to go to emergency room or something like that? Part of our issue with the teams are fine. There's nothing wrong with them. It's not an easy job. It's very hard to get people willing to provide that job and or to take that job. But also it's not funded like, say, EMTs and law enforcement. It's not a firehouse model, right? So unfortunately, sometimes some of them are, but other ones are just people at home and the crisis call comes in, you got to call them at their home and then they get ready and go out. So it's just not, part of it is a funding issue. But I have to say, like, I am also well aware of really cool like EMT co-responder models and stuff, and those are really good. I think part of what we're missing in our system is very trauma informed, and it helps people who are triggered and don't want flashing lights outside their house, right? And have had bad experiences. It's really nice. But we're really trying to look at the quality and funding of those teams to make sure that they get their own time and they're well equipped. But like, people have to trust them to come out, you know? And I, like, a lot of people feel more, if an ambulance is coming to my home, I'm going to feel better than an unlicensed person in an unmarked vehicle. Some people want that. Either way, we're trying to make sure that we have well qualified, well trained mental health professionals going out, typically with a peer.
All right, Sheriff Burkhead.
Thank you, Justice Earls, and thank you, Kelly, for this presentation. This is a heavy lift. This is a heavy lift in that it's a complete paradigm shift from what we're accustomed to. And I have a few questions, but I'd like for you to highlight. You mentioned data to determine where the centers would be located. I'd love to have a look at that data, and I'd also like to propose, as we drill down to the data, could we consider regional centers? The state is broken up into regions, and certainly we cannot build a center in every county, but perhaps we could build 5 or 6 across the state that serve multiple counties as a regional facility. First question. Second one is with their EMT model, which I like quite a bit because of the structure and the layers of response that could be provided. Are we looking at expanding that model and embed a licensed clinician or someone who can assist EMT and law enforcement with these in this co-responder model? I 100% support the co-responder model. We're trying it here in Durham. It's working to a degree. I haven't yet seen all the data that they have, but I know it's a model that is effective across the country. And so I'm very interested in hearing more about that. And I'll give you one more. My concern is that this is surface level. And we address the things at the surface level. I'll use the term low-hanging fruit, but what's on the back end? The person who has not only the severe mental health issue, but also has underlying health issues. And then they can only stay in the facility so long. They get sent back to the community or to the home. Things start to spiral out of control again. And again, the cycle continues. while I applaud what we're trying to do in North Carolina, and we're considering being a pilot here in Durham, I'd like to see a little more substance as we move forward through this process. Thank you.
Thank you so much for that, Sheriff. And I'm not brief, but I'm going to try. We spend a lot of time as a state and also with other states talking about the best crisis models. And there's a lot of divided opinion. And I would say on the furthest end of the spectrum in the mental health field is we should have these mental health only response teams, only ever call in EMT and law enforcement in the most drastic of situations because of trauma. So that's kind of the far end of the spectrum. You have other states on the totally other end of the spectrum who do nothing but co-responder teams. All their mobile crisis is embedded at 911. All responses are through 911. And they will triage and send out the mental health professional team with EMT and law enforcement as needed. And they love that model, and that works for them as a state. I think, I don't know if it's right, sir, but I think we're trying to fund all of them because communities need to do what works for them. And I'd be naive if I didn't recognize how successful and exciting some of the co-responder models that counties are doing right now and how well they're working. They are. And so we want to support more of those. I think overall, like as a nation, we're trying to figure out what we don't want to do is duplicate. Like we have a well-functioning 911 system. So how do we have a well-functioning 988 and crisis response system? But then ultimately, how do they all work together? Like in this wonderful nirvana that maybe we'll get to in 20 years, like we can have one call line, the right teams are deployed, and it all works together really seamlessly. I think that would be ideal. We're definitely not there. But I think we want to support all models across North Carolina, mobile crisis teams, adolescent-specific ones, and then all through to co-responder models, because we do think they work. But there's still a lot of discomfort with co-responder models from a lot of folks. In terms of urgent cares and FVCs, one of the things we're working on really hard on multiple levels and with the General Assembly is the financing of them. The real issue is that urgent cares, behavioral health urgent cares, you've never heard of them? They're rare. They're typically fully funded through state and county dollars. Nobody covers them. So no insurers cover them. So that's part of our conversation with the General Assembly. Blue Cross doesn't cover them. Aetna doesn't cover them. Veterans Administration doesn't cover them, right? And they're not bad insurance companies. They're a very public thing. They're a very public safety net thing. So they're quite expensive. We think they're really valuable, but typically the ones that run take a lot of county funding and state funding to keep going. And that's rough because all counties don't have the same amount of money and we have very limited state dollars. So how do we get other insurers to cover them? But also, we're not overbuilding them right now. We haven't, like the new beds we added, you see they're not in every county. But again, we're hopefully making smart investments and figuring out the financing on the back end so we can keep these going and expand responsibly where they need to be. I think the regional model makes a heck of a lot of sense. And one of the things we've been working on, if any of you know, like the LMEs all have their own region, right, with counties. We're trying to work really hard with them. And we're stepping up too to say, this is a statewide crisis system. It's not regional. It's not. I mean, it's not your region and your region. It's a state system. Urgent cares and facility crisis centers serve everybody across the state. They're North Carolina's crisis system. So we're trying to work with them, make sure we don't have haves and have-nots, rich counties and poor counties, so you get some, but we're using data to say, where do we genuinely need them and how are they available for all? And also, sir, how do they operate the same way? I don't see the sheriff on here, but to sheriff in a county, he's got a crisis center. Every time he takes people there, they say, oh, he's too complex, send him away. That's not cool. That's not how we need to support law enforcement, and that's not how we need our crisis centers to work, right? So they'll need to work predictably, and we need adequate access. So like if we make a commitment to law enforcement that if you drop someone else, they'll take them, we have to have that commitment across the system. There's so much I could say. I love all your comments, sir. Oh, as to building up the infrastructure underneath, like I mentioned the FACT team, but you're quite right, right? We mean it when we say crisis to care. I didn't talk much about the service delivery system, but why the heck are we in so much crisis, y'all? Like that's the part that is very frustrating.
Right.
When I started this job, I promise you, I had no idea I would spend so much of my time on crisis. Didn't expect it. Totally stunned by it, but I've just leaned into it. We've got to make sure the crisis system actually works and is effective, but we've got to stop being in crisis so much. And that's why if you look at our whole plan, it is very much our community infrastructure, access to it, understanding of it is not cutting it. People wait too long for appointments. They don't know how to find appointments. And the services we provide with the workforce we have are not getting it done. They're not. I'm sorry. I know that sounds really, really critical, but we've got to improve the quality of services. We've got to move people into long-term recovery. So they're not just going from crisis to crisis to crisis to crisis. So that's the rest of our plan, sir. Like, yep, crisis has got to work and to get the job done, but we got to get out of this cycle of perpetual crisis.
Great. I agree. Thank you so much.
Assistant Secretary Bryant? We're not hearing you.
I put my hand down, but I didn't unmute myself.
That's all right. We hear you now.
And I'm not the best at WebEx. I was responding and thinking, to several comments in the last string of comments and most recently to what Kelly was just saying. I was moved by her comment, why are we in so much crisis? And then I think we have to add, alongside that question, we have to look at what we emphasize. In some ways, even emphasize a 988, which is so much like 911, we're sort of steering people toward crisis. And do people know, and are we saying you can call 988 if you just feel a little anxious, you don't have to be falling apart, or if you think you might need some kind of mental health support, you don't, for yourself or somebody in your family upstream, in the first instance, versus feeling like it's an emergency. So I think we need to have, and this is perhaps outside the scope of these investments, maybe, I'm not sure, but it would seem like we might want to address the root cause, which is we aren't educating our community about how to recognize and address mental health issues and get support early on for yourself and your family. And some of that's about the LME MCO process. We have the mixed, now with Medicaid expansion, we have a better payer system, but it used to be we didn't have enough money. Even if people had a problem, we didn't have any money to help. So I think we need to look upstream. But then more, the additional point I wanted to make, not to take up too much time, is that I think we need more heat maps geographically around these investments. And I have mentioned this to you and the staff, various subcomponents of the staff. Like the one map you use had a whited out area in the east without the counties clearly defined. So it was hard for me to determine what the other ones were, in terms of looking at the map and figuring out, where things were. So I think we need more heat maps. So these approaches by county and or by region are more accessible for folks, and we can get more really relevant to the point comments, per initiative around these things geographically, and then where there are patterns of whole regions that are just not addressed, we can advocate, based on that information. So those would be the two things I would mention.
Thank you so much for that. I always appreciate your comments on how we can improve our map and how we're showing things to folks. But your point about 988 is absolutely wonderful. And like right now, we think there was such a big response into the Pure line purely because they're easy to recognize numbers, purely. So you see Charles on here, and I know that some of you know Charles already, but part of what Charles's teams is working on are just access in general, access and education. So that's everything from our anti-stigma and education campaigns to we're putting together, we don't know what it's going to be called yet, right? Because that's actually part of the issue. What is a website and a number where people can just get into appointments? Like, let's not be afraid of appointments, and let's tell you how to get one quite easily the
Yeah.
next day, right? So we're trying to we call it open to care, access to care. But the reality is that across North Carolina, like if you just look at our population, pure statistical perspective, 2.5 million at a minimum, I'm not exaggerating, North Carolinians could benefit from mental health and substance use services.
Well, Kelly, the thing I would say county to county, if you go into any county now and
Yeah.
Google mental health, or
Priority for
I
everyone.
don't know what the marketing people would say. Most people would Google or search on your phone,
Yeah.
but you don't
Yeah.
even get the LME-MCO. And
You
even
don't. What is
those-
that?
And
What is
even
that?
that
Yeah.
system, even we named that's a ridiculous name. It's not a name. you can
Ridiculous.
brand.
I agree.
I mean, it's like Tailored Care Management who came up with
I
that.
know, Angela. I know.
So we need a way to make this, accessible to everyone. And I would just like there to be
You're
a
singing
way
my song.
when you Google mental health or, counseling or therapy or something, that you get sent to a place
Agree.
and that people know there are public funded services. I'm not even sure
100% agree.
people understand that there are funding services that we're all entitled to. So anyway, I'll
100%
get off
agree.
my soapbox on that. And
That is my soapbox. I'm with you on the soapbox. I promise you we are working on that.
thank you.
Nobody knows where anything is. As I said, 2.5 million need services. If you just look at publicly, like individuals who have Medicaid, that's like 3 million, right? Again, a quarter of those, so like 750 to 800,000 could use mental health services. You know how many people get public services? About 200,000. Like, we're not even getting like the uninsured and the Medicaid insured folks who probably statistically could use mental health and substance use services. Part of it is definitely stigma, but part of it is just the confusing system. So again, 988 has been a boon in that regard. I hear your point about crisis, but we've even talking at the national level about 988. It is the suicide and crisis lifeline that people are, vast majority, 88% of people are calling aren't remotely in crisis. They're just looking for services. So we're just fine, good. Then we're going to get you services through 988. But there are better ways that we need to advertise the system. 100% agree. We're working on that.
Lieutenant Garden?
Hey, good morning. Can you hear me?
Yes.
All right. I was having some issues with my mic earlier, but I just wanted to chime in here and tell Kelly, thank you for the presentation. I thought it was great. Some of the things that, being closer to the streets and watching the system, and Kelly made the statement earlier, our system is failing our folks who need it the most. And it really is. Being out here and seeing folks suffering from mental illness, constantly, having 911 called on them, officers show up, and basically you just don't have a place to take them. And sometimes we end up transporting folks to jail because it's the safest place for them because there's no mental health facility available. So the idea that, there's going to be alternative places to go, just that somebody's having that conversation is very exciting to me. The other thing I'll touch on is the transport piece. And I don't know if you all are even doing this or not, but thinking about promoting this program to the bosses of the organizations, the leaders, the sheriffs and chiefs and things of that nature, or even the municipality, local governments, explaining to them just how much they will save on manpower, time, and fuel for that reason. Maybe a way to not only gain support, but to also some funding as well, because I know we spend a tremendous amount of time and resources. Even the paperwork that has to be transferred from one place to the next, police officers have to do it. And I think the main reason is because we're always going to be available. Whereas, 2:30 in the morning, somebody else may be at home asleep. You're going to always be able to call 911. So I think at least having the conversation is exciting, but in an effort to gain more understanding and to get more support, I think reaching out to those municipalities, their local governments, and the leaders of those organizations, and really having that data to prove that this idea is going to be helpful. Because I don't think I don't think you're going to find that police officers are against this at all. Probably, we're probably more for it than most people would think, because we're in the mental health business, not because
I know.
we're got it in a headlock and don't want to release it. We're in the mental health business because nobody else is willing to do it.
I know.
30 and 3 o'clock in the morning. I think that's one of the biggest issues. And like you said earlier, finding these licensed clinicians and folks who are willing to do that work at the state level, given pay and benefits and things like that, versus what some private industry will offer them. So I think, you know, until we work that piece out, law enforcement's going to always have a seat at this table, but we would be more than happy to allow someone else to sit down if we can figure that piece out.
I'll bet.
So you've got my support if nothing else. If I can help in any way, please let me know.
Thank you, Lieutenant.
Sheriff Firkin.
Yeah, just very briefly, I agree with Lieutenant on his point. My concern is, well, first of all, we need to change the transportation agreement in every county. We're kicking the one in Durham around like a soccer ball, and no one seems to want to take ownership, which will always fall back to law enforcement. That's my first concern.
I know.
Second concern is when we do this, your funding is limited. And so when the $20 million runs out and we haven't been successful in standing up a sustainable option, then law enforcement's going to have to jump right back in.
Yep.
So I don't want it to be a tease. So so those are my concerns, and which is why, again, I advocate for co-responder, and we do it head on, and everybody has a stake, and everybody has a seat at the table, and we're all talking about this, not in a room over here where it says, and I'm just being honest, let's get rid of law enforcement. We don't need them showing up because they traumatize more people than that's just not true. And I hear it all, I just hear it all the time.
Yeah.
We've been doing this, let me speak for Clarence. I've been doing this for 40 years.
Yep.
And the first thing I learned as a deputy in Randolph County is how to interact with someone who's in a mental health crisis.
Yes.
Because no one was coming to help me.
That's right.
Okay. So I'm very passionate about keeping law enforcement centered on what they're supposed to do, but not relegating us to, oh, we'll call them when we need them. No, that's not the way it works. So we need to work on the contracts. We need to work on the sustainability model. And, and again, I'm going to always advocate for co-responder. Thank you.
Yes to all of that. And thank you for that, sir. And I typically, when I go to audiences, I actually tell them about my experiences calling 911 and how I am eternally grateful to EMT and law enforcement. You're predictable, you were kind, and my son had a seizure, right? And I was explaining how that's the way it's supposed to work, and I'm grateful. Y'all were there in 5 minutes, and you were kind and compassionate, and I was hysterical, and you helped my son, and I will never forget that. And so, like, I'm eternally grateful. And I want our mental health system to align with that and to support that in ways that I don't think that we're doing right now.
Well, Kelly, you've been incredibly generous with your time. I just want to thank you for all you're doing. Thank you for the presentation. I'm hoping that we can have those slides so we can, because you gave us so much information.
Yes, of course. Yes.
And then I just want to ask you a final question about if there is anything on your wish list that the task force would do. I mean, this has been incredibly helpful that we have this information now. Our local committee, for example, can include this in their presentations. We can spread the word about the August 29th opportunity. And it seems to me we can also voice, you know, what you told us about the service gap is pretty staggering, right? But what else is there anything else you can think of that this task force could be doing to be helpful?
I think if you can help us advocate for some of the sustainability things that folks mentioned here today, but also we appreciate your guidance. Every time I talk, I learn something, and that's why more of my team are on today, because there are different, there are folks here that represent groups that we should be talking to, that we can be partnering with better, that we can like be braiding and blending our funding together, but also, uh, like having joint voice to the General Assembly. So I think all of that's really helpful, just the partnerships and the advice that we're getting from folks. But I would always appreciate the advocacy on the sustainability of these models. It's really hard just to get mental health funding. And I truly believe, because my secretary told me so, and I believe Secretary Kinsley, that a big reason we got a lot of the different behavioral health funding we had was because the support of the sheriffs and the Sheriff Association in North Carolina. So I'm eternally grateful that you all helped us with behavioral health funding. So thank you for that.
Right. Well, thank you so much. This has been enormously helpful, and just really appreciate all the work you're doing and taking the time to share that with us.
Thanks for having us.
I think we can now move to hearing from the committees, and we'll start off with the Executive Committee, and Lieutenant Garten, can you give us your report?
Hello, everyone. The executive committee met in May. We heard from the State Board of Education and the Department of Public Safety and Juvenile Justice Division on databases. The State Board of Education presented on their data around school discipline and demonstrated how to access the database in the dashboard. The Juvenile Justice presented on their school justice partnership dashboard, and they all provided details on how the data is collected and then how it's presented. We spoke to them about overlaps between the two data points and systems and the databases and ways to connect the two. There were some reasons why they were not interfacing together. They're working through ways to make them link together. So when you access one, you can actually go and access the other two. The executive committee had a planning meeting in July where we reviewed our work and up to date. We prioritized topics in the meeting and some of the things that we wanted to focus our energy and efforts on. We came up with 3 major topics, one being body-worn cameras for local smaller jurisdictions who don't already have them, ways for folks to have funding for those body-worn cameras. We talked about the use of force in jails, standardized use of force as it relates to the jails and detention facilities in the state. We find that we, as a committee, believe it's very important that we put out something and a best practice kind of thing on how to standardize the use of force, both selection and application of force, and the reporting of the use of forces in our jails and detention facilities. As we know, they're all ran in different ways, and some of that reporting is different, and we'd like to see a little more standardization on that as well. And then the final topic we had was ways to carry track forward in the 2025 year coming up. In our August meeting, the committee will hear updates on body-worn cameras, grant funding from the Governor's Crime Commission, and we'll have an overview on a body-worn camera policy, procedures, and implementation from the Raleigh Police Department as well. That's pretty much what the executive committee is working on. We'll try to answer any questions if anybody has any.
Does anyone have any questions? I don't see any. I would just say, as your committee is going forward and in your August meeting, if there are recommendations ultimately, say around the policies on body-worn cameras that you think TREC should make as part of its final report to the governor, please know that that's an option. If that seems like that would be useful.
Yes, ma'am.
Okay, so then next we'll have a report from the Judicial Committee, and that's Nisha Williams.
Hello, good morning, everyone. Can you hear me?
Yes.
Wonderful. What I wanted to do this morning was to give you all an update of what the Judicial Committee has been doing over the past half of the year so far. And that way, I think it will best illustrate our July updates as well. So first, I wanted to start with January. During our January planning session, we initially identified several concerns and hot topics that we wanted to support throughout the 2024 implementation year. What we decided to move forward with, particularly for 2024, was to focus on reentry simulations, fines and fees, school justice, partnerships, and barriers to jury service. During our February meeting, we actually discussed partnering with the DAC and other community agencies to support additional reentry simulations this year. We were able to host one in the western area of the state, and later on this fall in October, we will be hosting one in the eastern area of the state. So we began that planning in February. During the February meeting, the Judicial Committee also supported a presentation to this full TREC body on the school justice partnerships, with Judge Corpening presenting to you all. During the month of March, our committee also hosted a virtual screening of judging juries that documented barriers to jury service. If you recall, this was a video that discussed the benefits of paying jurors and highlighted jury reform work that was happening in California. During the month of April, we heard a presentation from the Coalition Against Fines and Fees. Keisha Millett presented to us. We also held the Western Reentry Simulation in Asheville on April 4th. Also, during our TREC quarterly meeting in April, all the members heard from panelists that addressed the topic of mental health resources in jail. We, as the committee, helped facilitate that presentation, and we also recommended the TREC committee members view the Fractured documentary that depicted the issue of delays in capacity determination and restoration. During our main monthly meeting, the committee discussed how to use state-level data on capacity restoration, and we also discussed an upcoming Justice Unbound symposium that was held in June. During our June meeting, our committee discussed the fines and fees toolkit that was created by Forward Justice and how to best utilize this toolkit. We also discussed this project called the Court Appearance Project and how TREC can be involved. And we also received an update on the Inclusive Juries Project. These, namely the Inclusive Jury Project recommendation, does support TREC recommendations 91 through 93. And lastly, in our July meeting, we discussed two potential projects that we want to implement before the end of 2024. We are looking at criminal justice reform organizations documenting that, as well as looking at additional capacity deficiencies. We're also hoping that Pew Research may be a potential partner in a project around some data metrics. And we will be having a TREC conversation on August 15th with North Carolina law schools and law students that will be facilitated or led by April Dawson at Central, as well as Emily Coward with Duke Sanford School of Public Policy. So we've been very busy over here at the Judicial Committee. And again, also lastly, the Eastern Reentry Simulation will be held at ECU on Monday, October 14th, and we will be sending out information regarding registration for that as the time gets closer. I invite any questions at this point.
I don't see anyone with questions. Thank you for that report. I want to, this seems like an appropriate time because it's judicial related. We also wanted to get an update from Representative Morey on the work of the Juvenile Sentence Review Board. So if could you fill us in on what your board has been doing?
Yeah, thank you. I hope the computer doesn't think out on me again. Sorry about that. The Juvenile Sentencing Review Board was one of the TREC's main recommendations. And in April of 2021, Governor Cooper signed an executive order creating what is the Juvenile Sentencing Review to look at any juvenile who is under the age of 18 who committed a crime and has been in prison for at least 20 years, in some occasion 15 years on stacked sentences, that we would look at every case that is petitioned before 4 of us are members of this panel, Judge Allison Duncan, Thomas Walker, Mickey Michaud, and myself. We look at cases that are presented. We've reviewed over 160 cases over 2.5 years. We've met over 20 times. These take hours and hours of review. We get petitions that are often over 200 pages long. And we look to see how the rehabilitation has been in prison, what their age is, what the circumstances of the crime was, infraction records, letters of support, how strong a reentry plan is. And we vote on if we recommend to the governor's office that he consider commutation or clemency on these petitions. Once we do our recommendations to the office of the governor, their staff does a lot of work in contacting the DA of the sentencing county, of talking to potential victims, making other inquiries, checking out the reentry plans on job opportunities, placement back in whatever community it would be. It's very gratifying work. We still have probably over 100 petitions to go before the end of the year. We're going to be meeting very often, very frequently. But we've had at least 5 on the juvenile sentencing review that have been released by the governor. There were 3 others that were close to being juveniles that were just recently released in an announcement. So we appreciate the TREC recommendation. We're working hard on it. And if you have any questions, be happy to answer. Thank you.
Does anyone have any questions? Thank you so much for that report and for all that work. I guess my only question would be, is it the vision of the board that you'll finish by the end of the year, or that there will be a need to continue into the next year?
We're going to look at every petition that's been submitted at all possible. We hope this is going to go into the next administration because it's very worthwhile. We have some kids in this state that were sentenced at the age of 15, and now they're in their 60s. And, you know, justice and mercy and the recommendations of TREC are so important on this. You know, are they ready to come out and not really die in prison? And so it's very humbling to look at these cases. The decisions are big, but we're hoping we're going to see a lot more granted clemency before Governor Cooper's administration is over.
Great. Thank you. Really appreciate getting that update. And again, Nisha, again, thank you for the report from the Judicial Committee. But and that seems to me to lead quite naturally to Senator Mohammed and the Legislative Committee.
Morning, Justice Earls. I apologize to everyone. I think my 8-year-old was messing with my laptop, so I can't figure out how to get my camera on. I've tried to get in again, but something's wrong with it. I hope y'all are doing well. So the Legislative Committee, of course, Representative Marcia Morey, that you heard from. The Olympics are happening now, so we should always continue to celebrate our great Olympian on this task force. Sheriff Burkett from Durham, and my own Chief Jennings. Thank you so much for being part of the team. Of course, Caroline and the rest of our wonderful friends. Real quick, as far as the Legislative Committee, as you all know, I think I've discussed it many times. I think our work has primarily focused on doing harm reduction at the North Carolina General Assembly, trying to do everything that we can in every type of format to try to continue to push and advocate for the TREC recommendations. Based on that, after I think we had our last task force meeting together, we got a bunch of stakeholders together to continue to focus on driver's license restorations. We had folks from Duke come speak and present to us on fines and fees from the Center for Criminal Justice. We had the DMV officials join us. We had AOC officials join us. We even had folks from Senator Berger's office, the pro tem office, join us and participate in this conversation. Unfortunately, we weren't able to push anything through the short session to relate it to fines and fees. I'm hopeful in talking to the pro tem's office that they are still very much interested in doing something about fines and fees. So I'm hopeful, hopefully in the next long session, we might be able to get something and do something there. We've again continued to be focused on, like I said, harm reduction. Many of you has heard about the changes in juvenile justice as well. House Bill 834 recently passed. I'm one of the members from the legislature that worked intricately on this bill. It's not the perfect bill, I'll tell you. Unfortunately, the original version was far drastic and worse, in my opinion. They were essentially removing secure custody hearings for children, which I thought was really bad, and making them every 30 days. We were able to get them back in, at least at a motion of any party. In addition, there are changes when it comes to the 16, 17-year-olds, when it comes to A through E felonies. They're going to be going now straight to the adult criminal justice system. Many of them were already being transferred to the adult criminal justice system. Unfortunately, now we'll be removing the juvenile piece, and hopefully we can make progress on that in the future. But I think the focus of TREC and many of us in your local committees and in whatever capacities you have should be continued focus on doing everything we can to preserve and protect the juvenile justice system, to expand on its resources and continue to grow. So with that being said, we continue to plan to have more listening sessions and more educational, engaging sessions going forward in the next couple of months related to juvenile justice issues, reentry services like we heard about today. I'm proud of our wonderful task force members. They're brilliant, intelligent people, and they've had wonderful insights. And I'm thankful, especially for Chief Jennings and Sheriff Burkhead, being part of the law enforcement community and their relationships through the various stakeholders to continue this work. Thank you, Justice.
Does anyone have any questions or comments, reactions? Well, I have a question, which I'm not sure if it's for any member of the legislative committee or possibly the local policy committee, but I'm just curious in getting a sense of the landscape of who's working on this is relating to the protecting the juvenile justice system, protecting raise the age, and are there, and also recognizing that, and I don't know, at least one group, I think NC Cred is basically winding down its operations. So are there other groups that are working in collaboration to do some of this advocacy? Like, is that happening?
Justice Earls, I'll be very frank with you, and Representative Moraes here as well. It's been tough over the past couple of years with the number of advocates. I think there's been a lot of different turnaround there. Yeah, it's been difficult to get a lot of support on a lot of these issues. We're trying to do the best we can, but I'm hopeful the Justice Center, they've had changes there, and we'll get more people to support our work. I know Kerwin's here. He's been tremendously advocating him and with the organization Emancipate NC. But I think it's really, really critically important to hear from our law enforcement community to understand that this is really bad for public safety at the end of the day. So we've got to figure out a way to build a better relationship with our prosecutors, which have a tremendous amount of power at the North Carolina General Assembly, the Sheriff's Association, which has a tremendous amount of power, and the Police Chiefs Association. So until we get some balance with those folks, it's going to continue to be an uphill battle, Justice Earls. And that's part of the reason why we saw the changes that we saw with House Bill 834. We tried to preserve and protect whatever changes we've had for raise the age. I'm thankful for certain procedures, like there's a removal process from adult court back into juvenile court. I know a lot of critics say that doesn't happen enough, so it's likely not going to happen. But we're trying to do everything that we can to reduce harm. But we definitely need help. So folks that are on the other committees, I would urge you to have those conversations within your own committees and figure out a way how we can implement change and preserve and protect our juvenile courts in the North Carolina General Assembly. I know Department of Public Safety has been instrumental. Secretary Lazater has been very, very helpful. So there's a number of folks that have been able to participate. ACLU has been helpful where they can be as well. But we could always use more help at the North Carolina General Assembly.
Well, and I hear you thank you for that. And I, for what I've seen of kind of reading about these kinds of efforts in other states, that emphasizing the public safety component, that is to say, the things that we want to see happen really are the best ways to improve public safety, is an important theme to be successful. So I think you've hit on a really important point. So thank you for that.
Thank you, Mr.
And
Searles. If you're okay, if Representative Morey or any of the other committee members want to add anything I might have missed, feel free to chime in. Thank you. Representative Morey?
Thanks. Yeah, Senator did a great job. I think we do have a challenge, and we're going to go in the long session, really trying to safeguard and protect what we did with Raise the Age. There's a lot of misinformation, data's that been misconstrued because it has been successful. It is smart on the way we handle young offenders, rehabilitate, recidivism goes down if they stay in the juvenile justice system. And we just need more collective voices. I think there's an ad hoc group that we used to have a juvenile justice advisory committee that gave advice to the General Assembly. They disbanded that. We need to bring that group back, or people like that, because they're the experts and they really know. When you throw a kid into the adult system and it's only punishment and fees, you're not going to get good results, and they're coming back out. And it's proven the juvenile justice system does so much better with helping get these youth back on track, being much better once they come out of it. So really appreciate TREC, and I think this is a big challenge we have going forward.
thank you. Anyone else?
I would simply echo what both my committee colleagues have said, and I will highlight two challenges: the capacity for juvenile justice in the juvenile justice system. Again, we can't help those young people if we can't place them in a suitable facility and get them the resources that they need. And Representative Morey is correct. There's a lot of false narrative floating around about the numbers, and we all know that juvenile crime is an issue, but I think Senator Mohammed said it earlier, we have to get the Conference of DAs on board to work with us, to communicate with us, to let us evaluate all the options for these young offenders and get them the assistance that they need. And I think if we are consistent with pushing that message, law enforcement will get more in line, so to speak.
I had a question. I don't know if there's time. This is Angela. Can you hear me? Yeah, okay.
I'm sorry. Yes, please go ahead.
And
Ahead.
this
We
is
have
on
time.
juvenile justice piece. I know I thought the move to change some of the provisions were, it was driven by DAs, and they had some concerns about something. I don't remember the specifics. So I was interested in what they were, but I also was wondering, is there any intersection between their concerns and anything about the need for increased efforts around violence prevention in our communities? Is there an intersection there that we need to be thinking about to preserve the juvenile justice, the raise the age provisions, in addition to, addressing whatever the concerns of the DAs were? And does anybody know what they were, if it can be, summarized concisely? Sorry.
Sure. Sure, I can do that, Angela. See here. I know with House Bill 834, so the 16, 17-year-olds, again, all the kids used to go to juvenile court originally after December 1, 2019. So what House Bill 834 did was took the 16, 17-year-olds if you're charged with the A through E felony, now the cases will begin as original jurisdiction in adult criminal court. So they're not going to start in juvenile court. Now the kids are still going to be housed in our juvenile justice facilities because they're minors until their 18th birthday. But that's where they'll start. In addition, there's changes to secure custody hearings, where originally detention hearings would be within 5 days of a juvenile being picked up. Then it would be every 10 days. The bill now changes it to every 30 days, but any party can request a hearing for an earlier date. So that could be the juvenile's attorney, the juvenile, the judge, the prosecutor, because the Conference of DAs was again telling us that they're overburdened. Many of these juveniles with much more serious offenses, they're going to stay in detention anyways. I know juvenile justice told us they're a bit stretched thin with resources as well, as far as transportation issues and things of that nature. So again, now we've changed it from every 10 days to every 30 days, but again, it can be brought up if needed. Again, there's a removal process as well now. So once the 16, 17 years are in adult criminal court, they can be brought back into juvenile court upon motion, joint motion. It's got to be by the prosecutor and the juvenile defender. Also, the Superior Court must also expunge those criminal charges and court record at the time of removal. There's also additional pieces related to enhancement of crimes for adults that solicit minors to commit crimes. So that's in the bill as well.
Okay, I was just curious as to was their complaint just about like how much time it was taking for them to do and their ability to address the provisions, or was there an increase in overall numbers of cases in this category? That's what I was trying to determine.
So Secretary Bryant,
Is it both? Is it both?
So
That's all.
Secretary Bryant, I think you heard Representative Morey talk about, in my opinion, there's a lot of misinformation out there. But at the end of the day, look, my own police chief is here, Chief Jennings, and I'm sure he'd love to speak on this issue. But I know there's a tremendous lack of resources. We did raise the age on December 1, 2019, but we haven't actually funded Raise the Age adequately, like law enforcement needs it to be funded. But the reality is we're still funding the criminal justice somewhere now in the adult system, unfortunately. I think there's a lot more supports. Being a former juvenile defender, Representative Moore is a former juvenile court judge here. She can tell you, and many of you probably know, there's tremendous resources. The recidivism rates, all those things are critically important in juvenile court. But unfortunately, we're not funding it and supporting it the way that we need to. So I think there's myths out there related to what we can and cannot do. And at the same time, there hasn't been the backbone by the General Assembly to adequately fund our juvenile courts, which is leading us to essentially watering down Raise the Age.
I understand. And is violence prevention, is beefing up our commitment to violence prevention and those kind of services, would that be a factor? Could that help, or is that just kind of a remote, you know?
In my opinion, it would, but unfortunately, again, we're not funding what we actually need to fund. We haven't had budgets that truly reflect your values and mine, unfortunately.
I got you. Okay.
I think I saw Chief, did you want to say something? Chief
Yeah,
Jennings?
you put it eloquently. That was really good. But I really don't think, and I know I'm speaking for myself and just a few that I speak with, but I don't think there's a lot of law enforcement that would care to see Raise the Age reversed or any. I mean, I think we're all fine with it. But like the senator said, the resources just aren't there. And I think that's what we're really pushing for. And it's not just detention, it's resources for rehabilitation and things that we can give these alternatives for the young people, because you can't raise the age and then just absolutely do nothing else and think that the system's just going to continue to go as it is. So that's been my complaint, and I'm sure many complaints from across the state with other chiefs and sheriffs.
Well, with the experts we have here, it seems like one of the things we could do before the end of the year is to clarify what's needed. You know, to give our version of what the problem is, if you know, our challenge is, and what funding is needed, at least so the advocates, the community, the people who would support our point of view would know what's needed and not get caught up in the, you know, the misinformation, as Judge Morey was saying. let's clarify what we can and put out there what we need, what we think the answer is. And bring all these pieces together, including the violence prevention piece. Thanks.
So thank you to the legislative committee. That is really tremendous work and so important. Mayor Blakely, you've been very patient. Let's get to the local committee.
Yeah, good afternoon, everybody. I'm here filling in for Mike Hawkins, who's on a very well-deserved vacation, who chairs our local policy committee, and we're very grateful for him. So I just want to make sure to lift him up. You mentioned Ricky Hurtado resigning. I just want to raise that up again and thank him for his work that he did at the local policy committee. We're really grateful for everything that he's done. And we're also very excited about Bernice joining our committee and the work that she's already starting. For public outreach, we continue to make track presentations across the state. Our focus has really been on the Council of Governments, the COGS, and their organizations that service county and municipal governments in 16 regions across the state. And by presenting the COGS, we can present directly to the key elected officials and staff in local government, like the mayors, county commission chairs, city and county managers, et cetera. And including the presentations that we've already made and the presentations that we have scheduled by mid-September, we will have covered about 72 of North Carolina's 100 counties this calendar year. And this ranges literally from all the way in the west to Murphy to all the way in the east to Manio. And we hope to hit all 100 counties before Christmas. For TREC, law enforcement, we continue to work with our Law Enforcement Advisory Group League to discuss issues of importance to law enforcement community and ways TREC might be of assistance. And I think our presentation today came from an earlier league meeting and is an example of the range of topics this committee is exploring. And finally, the Culture Project, we continue to work in conjunction with Duke University Law School's Wilson Center to survey and evaluate staff cultures in law enforcement agencies across the state. The idea is to see if there are ways in which TREC or other agencies may be of assistance in helping law enforcement agencies establish and maintain the kinds of internal culture values which ensure safe and effective policing in our communities around the state. And this summer, the Wilson Center has conducted surveys of selected law enforcement agencies. The deadline for the responses is actually today. And over the next few weeks, the Wilson Center will be compiling and correlating results and sharing with the agencies. As the year progresses further, we'll be working with them on next steps and expansion of the program. And that's what we have going on in the local policy committee.
Does anyone have any questions or comments? I don't see any. Well, thank you for that report and what tremendous work. Really appreciate it.
Thank you.
Now I'm excited to hear from Curran Pittman. He is our representative on the reentry. I'm not going to get the right name of the entity, but Curran, if you would give us an update on what the government coordination that's happening.
Definitely. Good morning, everybody. So I'm giving an update on the executive order 303. And so as you all may have heard, the Governor Cooper signed Executive Order 303 in January, establishing a whole of government coordination to improve reentry, rehabilitation, and education services across the state of North Carolina. This executive order established a joint reentry council, which is made up of every cabinet agency head, also as well as the Parole Commission and also the Office of Human Resources. But also this council is made up of a representative from TREC, which is myself. So we've met every month since January and heard a variety of presentations from different state agencies, state entities about hiring people with records, heard from local reentry councils, heard from healthcare coverage providers for justice involved people. Executive Order 303 calls for a reentry strategic plan that is going to be laid out to be implemented across the state by 2030. And it is due, the actual strategic plan is due this summer. But we'll give a annual report every December up until 2030. So this Joint Reentry Council is broken up into subcommittees who writes out the strategic plan, and we're close to finishing that strategic plan within the next week or so. The plan has objectives around 4 overarching goals: improve economic mobility for formerly incarcerated people by increasing the number of local reentry councils and providing access to educational, technical training, apprenticeship, and work-based learning and employment opportunities pre and post-release. Improve mental and physical health by expanding access to behavior health and substance use disorder services pre and post-release, and ensuring that all eligible incarcerated people obtain Medicaid upon release. Expanding housing opportunities for formerly incarcerated individuals, removing barriers to successfully reintegrate individuals back into the community, especially from historically underserved, marginalized communities. So we have objectives, and with these objectives, we've established bold goals to obtain these objectives. Each objective, we have strategies to make sure that we thoroughly obtain these objectives from multiple state agencies. Each objective, we do have metrics built into these objectives, performance metrics, to make sure that we're hitting our goals at every point and making sure that we're directly making an impact to where we need it most. I'm extremely excited about this work. As you all know, this type of work, reentry, recidivism reduction, is near and dear to my heart. And so ever since the signing of the Executive Order 303, we've seen a lot of people and a lot of agencies kind of step up and make a difference. The Department of Commerce, put forward funding for 3 new additional local reentry councils across the state. DAC has done a ton of work in signing people up for Medicaid while they're incarcerated. DOT has awarded a contract for transitional programs for individuals coming home to actually, be able to be trained and then pipeline into the DOT workforce. Myself, my organization has created a hotline that individuals can call who need resources. We've compiled over 800 reentry resources across the state, and individuals can call into this hotline and receive those information to those resources. So we're hoping to really get the ball rolling hard. That way, if God forbid, if anything happened after this year, it's going to be hard to stop. But we definitely appreciate you all's support for this initiative. I look forward to making a difference in North Carolina. And at this time, I can kind of entertain any questions. Zeeb, if I left something off, please feel free to jump in as well.
Are there any questions? Well, thank you, Kerwin, for that report and for that really important work. Really encouraging to hear that that's going on. And thank you for representing TREC. So that brings us, I am committed to getting us done and out in the next 3 minutes. So there's 3 important things I want you to know. Although our next meeting is as a full task force is not until December, it's crucial that the committees continue to meet and sort of wrap up the work that you want, that we've already heard now is on all of your agendas between now and the end of the year. And along those lines, let me just also really thank all the staff. I know you all are the key to us being able to do what we're doing, and just incredibly grateful to you. Second important thing is we will have an annual end of year report. So the committee chairs will be working with the staff to put that together, but be thinking about what do we want to tell the governor about what we've been doing, but equally importantly, are there additional recommendations that we should make? And it's possible that we would need to come back together in some form to vote on those as a full task force. But if any of the committees have additional recommendations that it would be valuable for us to make, that is still possible. And then the third important thing, we are wanting to be able to share with the governor our views on what should happen after December of 2024. And so I invite anyone who has some energy and enthusiasm to envision possible scenarios of TREC going forward. Please either email me or Brandy to volunteer, and we'll convene an ad hoc committee to do some more careful thinking about what we should recommend for the next year. So does anyone else have, no one signed up for public comment. So does anyone have any other things they want to bring to our attention? Any questions, comments? All right, seeing none, I think I have the power to adjourn us without even a motion. So let me thank you all for joining us today, for sticking around, and for your incredible work. It's really encouraging, and thank you all.